Lucille Chalmers is with us today and is the CEO of Queensland's Darling Downs Westmoreton PHN. We're fortunate to have heard from Lucille at the WA Collaborative Commissioning Partnership Forum, speaking on the foundations for success of the Queensland Commonwealth State Partnership and lessons for us in establishing a sustainable, future-proofed partnership for WA.
I think the most important the foundational element is around how having that one health system leadership mindset. We often in our day jobs, we're responsible for our organisation, our part of the health system. To come together to think about the entire system is actually something that's new for all of us. But if we don't do that, and if we don't step out of our own organisational kind of view of the world, we're not going to solve these problems from a whole of system perspective. Some of the other things to think about are around how you actually make this work happen and resourcing effectively a backbone team or a secretariat who can really work with each of the partners so they can work on the actual pieces of work, the projects and the doing, but they can also hold together the partnership in a way that you just can't do if you wait until the meetings happen or the broader sort of collective gatherings. You need someone who's going to be able to work with each of those partners with where they're at, because we know that some partners will at times need to sort of that they might be leaning in, but they sometimes might have to lean out because of what's happening in their own organisations. You don't want to lose them in that process. The other conversation I think is about just the scope of the partnership and how much it wants to bite off at the very beginning. There are so many ways that you could start here, making some clear decisions about what you will and won't focus on, and really committing to work on that for years, not just a sort of a 6-month pilot, I think is the other thing that's worth really taking some time to talk through and agree on, because you can't do everything. It's not possible. We know that.
Yeah. And that is a really good advice. Even in our preliminary meetings, we find that that there's a multitude of priorities from the different partners, and it's just distilling those, isn't it, into a few. And it's hard. It's hard. That's hard work, and people have to give and take a little bit, I think.
I think we tried to go too broad.
Yeah.
So we had 5 working groups in the first instance. Really 2 of them were successful. One of them was reasonably successful, but it was essentially a project that was kind of happening anyway. And then the other 2 just never got off the ground. So, 2 maybe areas of focus to get yourself started, to practice working in partnership. So we have established a regional health collaborative, which is a similar sort of alliance, which is just in our PHN region. So we have 2 HHSs, 5 Aboriginal medical services, and our Health Consumers Queensland, who are part of that regional approach. So we've been able to establish that with the support of all of the boards. We have a backbone team of 2 very clever people who, driving the strategy. We've built a health intelligence service that's supporting our decision making in that space. So we're able to, adopt some of the architecture, if you like, of what was happening at a state level, but applying it regionally. And we're finding the buy-in at that level is going very well. Partly because we've spent the time on building those relationships, but also we have existing relationships to build upon, and I think that's very helpful. At a state level, that can be a little bit more challenging, I think. But what we're really focused on is building that one system health leadership mindset at all levels of leadership. So we've known for a long time that all of the CEOs are engaged in this work. We get it, we know we need to do things differently, but if we're going to get success broadly and more sustainably moving forward, we need to get people thinking differently and doing that through the layers of leadership and having their involvement in these projects that go across the system and helping them see the outcomes of that are things that we think will make a big difference. It goes throughout that whole system, and coming back to that user journey or the patient journey as a touchstone, I think is helpful in that too.
Yeah, and that, I think that's a good parting message. It's it's bringing it back to the people who are at the receiving end of the care or the services.